Good morning, good afternoon, or good evening, whenever you're watching, wherever you're watching from. This is In the Middle. My name is Mike. Alongside me, well, 3,000 miles away, but next to me on the next screen over there is my co host TJ and the man who puts man in manly, Kyle. How's it going today, guys?
Hey, it's going good, Mikey. Again, thanks for having us on the show. Continuing our kind of healthcare topic, getting into another portion of healthcare, big pharma. Very excited to do this episode.
Oh, I am too, especially since we're going to get two different perspectives of, two different sides of the industry. I'm really excited about it. I've got some questions that I'm so excited to hear the answer to, especially to somebody who's, been in who are in these industries directly. Our first guest that we're going to have here, I have the honor of introducing, is going to be Tara. She is she is a pharmacist, and pleasure to have you here, Tara. Thank you so much for joining us.
Oh, thanks for having me.
It's really awesome. Really excited, and we can't wait to get to see the baby here.
Pick your brain.
Pick your brain, and I was more or less going to talk about the bundle of joy that's about to bless you and Kyle and keep you guys up for many nights. But
let's simmer
keep
down.
Us distracted
let's
for
simmer
a while.
down. They're having a girl. It's not like they're having a boy. It's not like it's going to matter in the real world.
Pin drop. That's what she's doing right now. Pin drop.
But awesome. I again really appreciate.
How far along are you?
Go ahead.
Third trimester. Pretty much 2 more months to go.
Ooh, you excited?
Yeah, it's coming up quicker than you can imagine.
Yes, I know.
Yeah.
I don't.
Well, that's great, guys.
Yeah, that's awesome. I can't wait to meet her, and I know she's going to be a bundle of joy for sure. But getting to the nitty gritty here of why we brought you on the show is to get your insight with the pharmaceutical industry and pick your brain, find out what's going on. What are your feelings about certain things? Being a pharmacist, I don't know if you'd like to give us kind of like a little background of what you know, so that way people are aware of what kind of information you bring to the table. I would definitely like to pass it on over to you, so that way you could let the people that are watching know what kind of information you know and whatnot.
Job
Sure.
Location, position, salary, that would all be very helpful.
How do you find me? So I am a pharmacist, like you mentioned. I have a doctorate in pharmacology, and I've been working as a retail pharmacist now for just under 9 years. Next month will be 9 years. I've been both a manager and a staff pharmacist, and so a lot of my knowledge base revolves in that particular arena. And for pharmacy, there are so many different types that you can go into, whether it's, retail, which is myself. The pharmacy in a hospital is also a very different kettle of fish. You can go into development of drugs, and like the list just goes on and on. So definitely, like, I have a huge retail background here.
So what you're trying to say is you know your stuff, right?
I know what I know, and I
know what you know
that I don't know certain things. Yeah.
She knows where the good stuff is, Mikey.
I got the key to the cabinet.
So,
yay!
Wow, that's dangerous. So one of my first questions is, when I see a pharmacist and being in that industry, what's your view on healthcare? What do you lean more towards? Do you lean more towards like a universal healthcare system, or do you lean more towards a privatized system?
Yeah. So, I mean, obviously, we currently have a privatized system, and there's good and bad for both. Personally, I think that, in my opinion, going to more of a universal healthcare system aligns more with my ideals as far as trying to get people healthcare that they need, and ideally putting less of a burden sometimes on our pocketbook, was what it comes down to as well. Obviously, there are some bad things with the universal healthcare system. A lot of people will tell you they have longer wait times and that sort of thing, especially for elective type procedures. But also those are procedures that aren't as immediately life or death threatening. So
Right.
for me, like, that is a switch off that I'm personally okay with. I would like to see us being able to provide for people, all people essentially, and not just people that have a good job that their employer can give them insurance for. And
Right.
then I'd like to see people be able to go to get medical help when they need it and not say, well, maybe this broken foot will just fix itself in a couple weeks. Right?
I did that, and it turned out completely fine. I got just a little gimp, but it came back stronger and better.
I mean,
Oh my God.
where I feel like in our society, we're in a place where we shouldn't have to make those choices. We shouldn't
Right.
have to say, like, just because, you don't make enough money, you don't have a job right now, that you're not entitled to healthcare, basic healthcare. And that just fits along with me caring for people, honestly. And that's why I got into my job.
Yeah, absolutely. I mean, I was doing some research and I seen Japanese, the Japan universal healthcare system. Actually, I kind of like what they do. Basically, if your procedure is deemed necessary, they pay 70%, and the civilian pays, or the patient civilian pays 30%. So, I mean, to me, I'm like, wow, that still gives people the ability to get the healthcare they need. Yeah, okay, it's money out of their pocket still, but wow, you're still not having to pay 70% of that bill. I mean, there's different programs all over the world. Yeah.
You still gotta, not to throw Japan underneath the bus. If you're a janitor, you're not going to get approved for that procedure, but maybe if you're a high up CEO, you will. So it is pick and choose there.
I would like to see your information on that, because as far as I've seen in all the research that I've seen, that it doesn't matter the job. You have the insurance, and essentially at that point, if it's a procedure that needs to be done, they will get it.
You just said approved, and that's the point of why that statement is approved. That they approve for your electoral fitness. The same thing with the stuff that we talked about with Europe, where even though Europe is a lot more laxy-daisy than Japan is a a lot more stricter of what they can approve and what they deny.
I think maybe what Mike was trying to say is that the procedure he was talking about might have been deemed necessary, not necessary,
like
elective.
A normal.
Right.
Yeah.
Right. Yeah.
Thank you, Tara.
Thank you. I'm glad somebody on this show actually understands me. Although that frightens me that Mikey. You speak Mikey. That kind of frightens me. But that's why.
Definitely do bring up an excellent point. That's why I continue saying, I'm stuck in this in-between world between government and privatizing, because I do believe in a lot of the basic cares being something that I think we can all kind of come together and agree on and make that a universal healthcare system. And when you get to the electives and stuff like that, where I believe privatizing and open things up may, again, when we had this conversation with our last episode, so I won't beat it down, may be beneficial. But I definitely do see that we could probably adopt some type of universal healthcare system here in the United States that can be a lot better than what we have. Because what we have currently now, and Tara, this is the only thing where I was talking with Mikey on last episode, where everyone's like, well, we have a privatized system. Like I'm saying, we do and we don't. It's very, you have this in between where you have government control and privatized going back and forth. And that's worse for us, because the government has lobbyists that are jacking up the costs and rising these things, and it's like it's very counterproductive. So in a system that we're supposed to have, because in privatized systems, and even in this world, it's lowered costs, it makes things competitive. But when you have a government and a privatized, and they both work together, we've noticed these prices skyrocket. Car insurance is another big thing. Health insurance is another big thing. Big pharma, and that's kind of what we brought you here, where we have a lot of conversations where somebody goes get some medication that costs $10 to make, but in the United States are being charged thousands of dollars.
So, and I'm gonna sit there and say that I think the part that you're missing, the common denomination of the issue, is the privatization part. See, here's the thing: is when you have a couple of companies competing for a contract, you would expect to be able to get the lowest, the cheapest bid, but it doesn't end up that way, because the way that they mark things up essentially makes it impossible for them to. And the only place that they're able to get away with that is in the United States. They don't get away with that in these other countries. In order for these other countries to keep that under control is to privatize that and tell these individual companies, if you have a medication that's going to beat what we have, you need to scientifically prove that it's going to be better than what we have. And then at that point, once it's gone through their approval process, it's going to replace it. But the price is not going to be, if it goes up, it's by very little, due to the fact that you don't have multiple companies putting markups on prices, so that way they can have trillions of dollars. And that's actually going to be one of my next questions to Tara, about profits that these pharmaceutical companies make. You don't see it in other countries. You just don't. And that's what drives it up.
So I'm just going to correct, because we kind of talked about this last episode and you're bringing it up again. When you go to Target and you buy toothpaste, do you get to pick what type of toothpaste you want?
Absolutely.
Do you get to pick, are they $20, $30, $40 for toothpaste, or are they relatively $3, $4, $5?
Well, good.
Okay. If
so
you go to Burger King, if you go buy TVs, the whole thing, Mikey, is that you're saying that a system doesn't work in one aspect when it works in every other single aspect of our lives and of our careers. So literally you're saying the problem is, and then there's 1,000,001 examples that I can just pull out from every single day that contradicts what you're saying. My thing is, I continue saying you're blaming it all on privatization, and I'm saying no, it's when you have the two going together. If you're forced to go to Subway every single week to buy a sandwich, Subway sandwiches will start to cost $30 a sandwich. It will not be $5. They will jack up their prices because you have to use them. When you have to use something and it's privatized, then yes, you're going to jack up the cost. But it's not the problem because it's privatized. It's because you're living in both systems. It's either got to be one or the other. This blend is what's causing the problem. And that's the point that I'm making. So to your question, which I do agree with, and I do want to ask Tara this and bring it up, the cost that Mikey's talking about of why things cost so much cheaper in these countries compared to us. Can you shine some light on that, or at least kind of maybe inform us or talk to us, or what do you see?
So there's a lot that goes into all the prices, and they're part of the reason why we're seeing differences in prices. So kind of what you guys were even talking about is similar to like a formula, right? An assurance. Like, so in an ideal private or in an ideal private sector, like, you would think that the market would dictate what a price on a medication is. And that we find is just not so. Part of it is because we have so many people with their hands in the same pie trying to get their piece out.
Exactly. Correct.
So they're influencing some of this as well. But there still is that underwriting idea that, the more of that similar product that's out there and the longer it's out there drives down the price. And we do see that. One of the things that we're seeing now that wasn't there before is third parties that are managing for insurances and groups of people, essentially formularies or pricing, and they're trying to leverage their group of people saying like they're going to be paying into this to try to negotiate costs. And so they're negotiating costs. They're not, letting the market free speak for themselves, I guess, is kind of
exactly, yes.
And they're taking a big piece out of the puzzle, like they're the pie, like they're taking a large bit, which they don't even have to exist. And then you have the insurance companies that seem to also dictate a lot of healthcare. No, we won't pay for that. Yes, we will pay for this. Oh, we might pay for this if your doctor has a really good reason and wants to talk to us about it. And they have a whole group of people that look at cost benefit analysis of all of their decisions and all of their reasons for these things, which is why, hey, we'll pay for this medication that does the same thing as this other medication, but for whatever reason, we determined that the medication that we will pay for ultimately is cheaper for us, and that's why we'll pay for it for you. And so that kind of creates a shift as well on, it's not just a free market when it comes to healthcare. There's too many people dictating things.
Yeah, and me and Mike were talking about that a lot on the last episode, which is there is too many hands in the pot. And I think that's why my biggest things, and everyone continues doing this battle between, capitalism and, free market and the universal healthcare system. And then they go back to the United States. But in my eyes, I don't see that, right? It's the same thing that you bring up. There's so many hands in this pot, and the government and again, my biggest thing is also when people are like, "Oh, I want universal health care." I don't really trust our government to run universal health care, to be honest with you. It's just because it is so corrupt, and there is so many lobbyists, and there are people. I mean, Obamacare. I mean, how great Obamacare was to the healthcare industry and insurance, and it's like what Mikey says. I mean, you got the numbers right here. Big Pharma prior to Obamacare made $3 trillion in profits during the 2010 the 2000 to 2010 decade. After Obamacare, they averaged about $85 billion a year. I mean, that's a huge gain. And I think, again, that's a lot of control, right? You're putting a lot of control and forcing, and then having people buy into insurance and telling what people can buy and what they can't buy, and insurance only covering certain products and not other products, and these things being too high. I think it's a broken system we have here. And I think it's a lot because of our government and the controls that they have on it with insurance and lobbyists and everything else they're putting into it.
Yeah. So I was doing some looking up here, and that kind of leads me into, which we're kind of already getting into the question that I'm kind of eager to ask. And I think this is going to kind of roll back into what you're saying, TJ. But from what you see and from your plain perspective, just speaking as Tara, when you hear that companies like Johnson & Johnson, after all their debt and whatnot is paid off, has a profit over $16 billion, and you hear that individuals like elderly people are having issues getting their regular medications. How does that make you feel, and what do you think would be a better fix? Do you think going privatized, or do you think privatized like TJ saying is going to fix it, or do you think going universal and doing something similar? I'm not saying exactly this, but maybe something similar to like where Japan, you have to basically prove that the medication is going to be better before it's put out there and given to the public.
Great question.
So, okay, so I feel like there's a couple questions in there.
There's a bunch of questions.
Sorry.
It was actually one question, but he had like little side things.
Yeah.
You pulled the TJ, Mikey.
I did. I'm sorry. I'm hanging out with you too much.
To address the Japan and having to prove it's a better medication, I don't like that idea. I do think that naturally our system advances towards better medication that improve on what is already there. Otherwise, what's the point? Because when they come to market, they're going to be way more costly than something that's already been proven to do the same thing that costs cheaper. So naturally, we don't see that too much. However, if something has a niche market where it may do better for a certain person, or somebody doesn't respond to one of the other medications, having those options or have a different side effect profile is always, I think, a good thing and good to have. I mean, options are good. Whether you use them or not speaks to the medication itself ultimately and how it is received for each individual. And then moving on to one of the other questions.
The million questions that was thrown out at you all at once.
Yeah. So
you started off really strong with that question, by the way, and then you kind of kept adding to it a little bit more, like I do, and you kind of lose it.
Yeah.
So I remember now. So you were asking about profits that these big companies make.
Yeah.
Yeah, how much they're making here compared to how much they're making in other places.
Yeah. So we have a system that naturally lends itself for these companies to do that. We have a capitalist system. All of our companies are trying to make a profit. That is what they are in business to do. Whether as a side effect of that, they can also do good in the world, or make innovation or save the planet or whatever. Ultimately, they're only going to be good if they make money in our current capitalist society, right? So it's hard to fault a company for making money and being able to profit and grow and continue. That being said, yes, these drugs come out to market and they are expensive, and for a lot of people, they can't afford those things, and that's why we buy insurance, because it helps cut those costs for us out of pocket and whatnot. And obviously some people can't afford them, or they don't have money or on fixed incomes, and it still makes it hard. Right. To develop a medication, that alone costs into the hundreds of millions of dollars, if not $1 billion. So you take that into account, and then you look at when we are developing new drugs and bringing them to market, 1 out of thousands actually succeed. So not only when you're looking at the price when it comes out, are you paying into what it costs to develop that medication that actually made it through, you're actually paying for all the ones that failed in their trials.
So I just had a real quick question in this before we get too far, because I know you got a lot on this, which is very interesting. Do you think that possibly because of our market, is America picking up the bill for the rest of the world? Is kind of with what when you're talking here, and it's kind of what I'm hearing, right? Is that America we make 40% of the drugs, we make 40% of the medical advances, but we also live in a capitalist society. It's like what you said, they are having money ranked in hand over fist to them, where they're being able to develop all this stuff while they really don't make a profit overseas and stuff like that. So are we paying into this to provide for the rest of the world?
We are, but I think I was looking into it. We're not paying into it disproportionately. So like you mentioned, that 40%, and that's about what our amount that we put into it. Like what we get out is about what we're putting in. And there are some countries that take out more than they put in, and there are some that put in more than they take out. But we're kind of in that, we're pretty proportional. Okay. It does seem, and when you don't really look into it too much, it seems like, oh yeah, like we're the ones that make all the drugs, we're the ones that do this and this, but it's further reaching that and that. Like we have a lot of companies overseas that make medications, and they're still doing research, and they're still contributing, and it's not disproportionate. is what I guess I want to say. So it may seem initially that it could be, but it's not. And that also looks into countries that also have a universal system. They're still, they're still paying into, what they take out as well. So it's not something that if we changed from universal to private or vice versa, that we would see potentially a change in, like, if we like dropped out of the, drug making business, we wouldn't have any new drugs for the world. Like, that isn't a thing.
Right. That's never been really a thing. But back to kind of with your insurance claim, and again, that's kind of where I always kind of have an issue with and stick my foot in. Insurance, I know it's like what you're saying, well, there's certain drugs out there that are high cost, and that's why insurance. But then I also see the opposite, right? Is that when insurance is involved, I've noticed insurance itself drives costs higher than what it needs to be. And I put off the last example in the last episode is LASIK eye surgery. I mean, that's not a drug, but this is just the example that I use, right? Is that when LASIK was covered under insurance, it was $100,000 per eye, right? The surgery cost you a lot of money. The moment insurance stopped covering it, and that's cosmetic. You don't need to see in life. You can live a happy life. We're going to stop covering it. So insurance stopped covering it. It became free to the market. Now you can go get your eyes done for $250 per eye. Minimum. I'm pretty sure that's from a doctor's that handshakes like this. It's probably not the best service. You come out all messed up. But it's a joke, right? Say a good doctor can do your eye $1,000 a piece. More realistically, that is what, a 99% decrease in price from insurance to the privatized capitalist free market. And I think that's, again, and there's plenty of examples of that. And I think that's why a lot of people drive into the free market. So to your point, is healthcare not actually benefiting us, or health insurance not really benefiting us in this society? It's more of a hindrance. What do you feel about that?
Well, honestly, I feel that they are a benefit, just because people are bad planners. Insurance is there, really. Insurance is there for those catastrophic events that you don't expect, right? You buy homeowners insurance for if your house were to burn down or flood or whatever, because it's a big investment and you don't plan to have that savings to be able to fix it yourself, right? Same thing for people. They don't plan that they're going to come down with, a stroke or a heart attack and have to pay, those types of medical bills. They're not prepared. They're not going to be prepared. And it's the last thing on their mind. So in that case, I think it's very beneficial for us as a society. They also use a collective amount of people to leverage actually lower costs in a lot of senses, okay? Because in a huge group of people, you're going to have a certain handful over here that are really sick and they need a lot of attention, and that attention costs money. And then you have all the rest of the people that either need less attention or no attention, but they're still paying into it, right? And so they're helping to offset those costs for some of the higher price ticket items. And so using that group, they are able to effectively get lower prices down. Does that mean that someone's paying into a system that they're not currently using? Potentially, yeah. If you're not going to the doctor, you don't have medications, whatnot. But one day you might, or you will, in most cases for people. So, and then that's there for you when that happens.
Yeah, and just kind of going on that, and that's one of my biggest things, is because then people say, oh, okay, that's fine. Well, if I go to the hospital, I'll get a bill. Oh, okay, yeah. Well, that bill, depending on your situation, could be over $100,000. The United States of America leads bankruptcies in medical due to medical expenses. They're blowing away number two. The number two country, which I think was Canada. I'm not going to be quoted on that. I don't have the information, but
unacceptable.
It's with here's the thing is that when that's another thing that's killing the market is these bankruptcies, because when you have these bankruptcies, well, that's it. Now those bills do not get paid. So now people have to go ahead and flip that bill for that individual who's not able to pay it, which is one reason why I was actually for as a part of Obamacare, which Trump took away, and I blew a fit over it. But that tax for you not having the health care and then possibly claiming bankruptcy and sticking the hospital with maybe a $100,000 or $800,000 bill, they're going to have to pass that cost on to somebody who has insurance and has the ability to pay. And that's sticking it to the people who are trying to be preventative. And that's why I still, will always push forth on universal health care.
Well, again, I also feel, the push on universal health care and insurance is two different pushes, right? Again, and I hear what you're saying with insurance and how it can help drive down costs and how it's there for the benefit. But let's speak honestly, insurance is a business. They don't want to give out money. They don't want to pay your bills. They will hold on to what they have to hold on to.
Right.
It's all about profits. It's all about stocks. So you are playing against a system that doesn't want you to win. That's the first thing with health insurance. They don't want you to have a $1 million incident and stuff like that. That's also a little bit of the problem. So again, I'm not arguing universal health care because I think universal health care is going to solve that issue, right? I mean, it's a government control. The government controls the prices. You're going to have all those stuff. So just a little bit of just confusion, because I think that's also where a lot of people go, you're not getting me into universal health care. And when people fight it with the word insurance, I don't think that's the right terminology. It's really getting rid of that, because like if you look at universal healthcare in other countries and other countries, universal healthcare is basic healthcare. It's not insurance. You can then get insurance for the elective and the supplements and stuff like that. And I think that's a better way to discuss the topic.
Yeah. So yep, go ahead, Tara.
Okay. Well, I was going to say one of the things that you might want to think about then, which I am totally for, is making healthcare all non-for-profit. So it takes away the idea that they have to potentially money grab these extra things because they don't need to. Any profit goes back into the company, goes back into us, essentially. So with these companies like, that make drugs, they wouldn't be beholden to stockholders to actually make that extra money. That money would go back to creating more testing or more development or that sort of thing. And it goes, or if your insurance company is, hey, we're up. So, hey, maybe next year we'll add a couple extra things to your plan, or hey, we'll bring down your premiums, or, something of that nature, where we're not still trying to cut down the middle line so we can get that X amount of cents extra so we can boost our stock.
I love that idea. I'm very pro for that, because I do want universal health care. I actually do want to see people who need care get care. I just want to pick the best option. And that actually, I actually want to now study up on that. I want to look into that, because that was actually very interesting. So actually, thank you for that piece.
There's nothing to say that we have to make profit off of health.
Yeah.
And you're right, because when you look at cancer research and stuff like that, there's nonprofit organizations that, give into that and, circulate the money through that way too. And I'm actually really interested in that, and I'm going to study up on that a lot more.
I would even say have look, although the nonprofit idea is an idea I never even thought of, and I think that could be a good idea. But with companies making profit is something that I'm not against. I'm okay with I'm okay with companies making profit, but where I get upset is where I see people like the CEOs and the stockholders are driving around in Maseratis, and there's people out that are scrounging change to see if they could get their PIP medication for next week. So that's where I say that there has to be a leverage. But your nonprofit idea, I think, is a great idea. People still make money. Your CEO is still going to make money. But just got to bring down those costs, and maybe they could even take those profits and put them back into the hospitals, so that way the burden of individuals are not, the burden of the patients don't have to pick up the bill for the people who claimed bankruptcies and didn't pay their bill.
So I think this is all really good. We're talking about healthcare in general, which is great. It goes with our last episode, but I want to turn it a little bit more towards the drugs, right? Let's kind of turn this down from not just universal healthcare, even though I think that is still what is driving all of this and all the costs and insurance and all that stuff. But let's kind of switch the dial to local medicine and big pharma and the costs of this, right? And I think you already kind of mentioned that the cost is driven here through a bunch of reasons. But again, for something to be made for $20, and I understand you're saying there's billions of dollars worth of research and all this stuff, but by the time it hits its markets, say the average cost of it, because you always hear that, right? Especially from overseas, the average cost of a medicine is $20, yet it costs $1,000 here in the United States. How much of that statement is actually correct and true?
That I would have to look into. So I know some places overseas, they don't have as early access to some of the new medications that we do when they come on the market. So that could be part of that. So I'm not sure if they're just looking at generics here versus generics there. That I don't have information on for you, sadly.
I guess she doesn't know it all, Kyle.
I told you, I know what I know, and I know some things that I don't know.
That's great. No, I'm always giving people a hard time. No, so definitely hearing you on that, but here's also a little bit of concern with big pharma and costs and the way that America is run. I went to a doctor down in Florida when I was down in Florida there, and I didn't have any high cholesterol. All my blood tests came back fine, yet the doctor was trying to get me on high cholesterol medication. So that's always been my biggest things, and I've heard about it a lot, how big pharma really tries to drive their product through doctors and hospitals and stuff like that. Can you speak on that? Do you see that as an issue? Do you see that doctors are always prescribing certain medication that you look at, right? And you'd be like, there's better medication out there than this. I mean, do you ever run into something like that?
So here's what I am aware of as far as that goes. Back in the day, a while ago, drug companies were allowed much more to advertise and cater to doctors to get them to become aware of new drugs on the market. They used to be able to take them out on lavish, vacations, give them a whole bunch of incentives, dinners, etc. And all under the guise of, hey, this is my new medication. Here's what it does. Here's what's different from what's already on the market, which is good information to have, because obviously we want to know if better medication is out there for our patients. But there have also been, I believe, laws passed that they aren't allowed to really do that as much anymore. There are strict guidelines on advertising essentially to doctors in that method. They have to be very careful and very stringent about what they can do as far as those types of incentives, where now they can have maybe an informative dinner, and that's about it. The lavish gifts that were once part of this whole system are no longer something that's allowed. So I think currently we see a lot of less of that. Whereas the new drug companies, they do come out and they do talk to the doctors and they do tell them about what's going on. And sometimes we do see doctors try out the new medications, obviously, if they think it could be right for their patient. But I think there's a lot less push forward from those drug companies to doctors now.
And what do you think was the cause of that? Do you think that was through to Obamacare? Do you think that Obama, or it could be through Obamacare, or it could be something else?
Obama's stuff.
I only ask because this relatively happened to me like 2013 when the doctor was trying to force me on medication that I didn't need to have. My cholesterol level and everything was fine. So when he was forcing me on this type of medication, it was very alert. I never went back to him pretty much.
Sure.
So I was just wondering, like, when did they start, like, kind of control this?
So there are guidelines so with certain disease conditions, there are guidelines that are regular published. They look at a whole group of data and see outcomes, and then they publish these guidelines that help or can help with how to control and manage certain disease states. And so an example would be, so current guidelines with people with diabetes, they recommend being on a statin or a cholesterol type medication because people with diabetes are shown to have a higher risk of heart-related events like a heart attack or a stroke.
I think it's actually a proper way to say it is diabetes, by the way. I think it's diabetes.
Diabetes. I'll stick with what I got going.
Stick to what you know. No That's comments from the peanut gallery.
No one remembers that commercial with that actor? Oh, no, I got diabetes.
yeah, man. The cowboy guy?
Yeah.
I remember him.
But yeah, I mean, they recommend cholesterol medication even if you don't have high cholesterol due to decrease of risk for that particular population. So obviously I don't know your medical, history and what you were talking with your doctor about at that time, but there could be other factors than just like you have, this disease, so you need this type of medication. Sometimes there are others. What now?
I'm as healthy as an ox. But I'm actually not supposed to be the size of an ox. So I'm not as healthy as a human. I'm as healthy as an ox.
20 minutes to a pound. We'll be there for a month.
Yeah, so I mean, there are some medications out there that they do recommend as a preventative versus a treatment. And so, I mean, there could be different reasons why the doctor had recommended that for you.
So as a person like myself, right, because this is such a, I mean, you need a degree in this field almost to talk about it. When you go in and you're just a person and you're obviously listen to your doctor, but when you do hear news and you do hear studies that doctors are going to sometimes prescribe you stuff that, how as us as individuals, how can we be better prepared?
And that's the hard thing. It's really hard to say that there's a way to do that. I mean, definitely getting involved and trying to understand your medications and your disease states. A lot of people literally do not know what medication they take. They don't know why. They don't know what it's for. They just take it because that's become their habit. And I definitely don't subscribe to that. I think you should definitely know what you're doing.
Agreed.
And I also recommend for my patients too, like when they have questions, like write them down before you go to your doctor's office. The doctor, when they see you, they have such a short time to talk to you. And a lot of times they're just trying to run through what they need to for that office visit. And, if you have questions, it's so easy for things to get lost in that shuffle of them trying to get their agenda done and over. And then it's like, oh, I guess that was it. And then you forgot, oh, I was supposed to ask that. So definitely I recommend writing down any questions that you might have because otherwise it's so easy to forget. But it is hard to advocate for yourself, especially if you don't feel like you know anything.
It's so funny because my mother has got the Holy Bible of my life. And I'm not joking. She has notes that it's funny. The doctors will ask her, oh, on XYZ, we did this. And my mom's like, no, that's not what I have. And she'll flip through her notes. She goes, on this day, we did this. And then a doctor will look through it. They're like, oh, yeah, you're right. And I'm like, oh, my God, my mother's notes are better than my doctor's. This is reassuring.
Everybody open your Mikey Bible to August 25th.
August 25th, 1996, 9:45 p.m.
At this point, your mom has like one person to like know and advocate about, whereas your doctor sees hundreds of patients, so they have to refer to their notes. And
what are you talking
to,
about, Tara? I'm the
shit.
most important. I am the most important. My name is Mike. Okay.
Do you see what's behind him? All right.
Yeah,
do you see what's behind him? He owns those.
I could see the pyramids from my TV.
Oh, so okay, so good laugh. I love laughing. Here's another thing, talking about drugs and big pharma, and of course the cost. And we definitely, I guess, are understanding the cost a little bit more. Talking to you, getting more of a better understanding of the whole process. But when we come to certain prescriptions, certain things that are on the market, the more studies that come out, right, there's so many side effects with a lot of stuff that's being produced out there. So one of my question is, and you can correct me definitely if I'm wrong, because I'm still confused, like where something comes out and it's like, oh, yeah, it didn't get past the whatever you guys, the FDA or something like that, but it's on the market. Yeah. And a couple of months later, it didn't get its approval, or you find out a year later that, there's hey, were you taking, we're all been up late. Have you been taking Xylylhome? Have you been shitting 3 different colors? It's just like, maybe. What's going on? You may qualify for a lawsuit. You're constantly hearing this kind of stuff. So when it comes to, again, big pharma and medication, how do we stay safe from just putting all this unhealthy stuff into our bodies?
Sure. So I think what you were talking about is actually a couple different scenarios. So there is not a current prescription drug on the market that is going to get on the market without approval from the FDA. It has to go through its trials. It has to prove safety and effectiveness, and it has to get approved. What you're talking about for those commercials is that, especially with newer drugs, part of the ongoing, essentially, trial is that they look at aftermarket research. What do we see long term? Because these drugs, they have to come to the market. Usually it still takes about 10 years, but some side effects or some issues may not crop up until even years after that, or It may crop up in larger populations that weren't seen in just the ones, studies that they have done. So the hey, those law firms that are like, hey, contact us because if you had this, then, whatever. Those are usually more of an aftermarket research that's still ongoing, that they may recall a medication because they find that, okay, we thought this was safe and effective, but maybe it turns out the safety isn't where we thought it was.
And this is kind of where it goes back to like our previous episode, or where I was talking with TJ, that America is so happy, and I get that you're given these drugs, you're prescribed these drugs, but unfortunately some things do take a long time to figure out that they're not good for you. Like asbestos. People were starting to put them in houses because it was supposed to be safer. People started getting lung disease. So things are always changing, and it's unfortunate. It's unfortunate that sometimes it takes 15 or 20 years to be able to see these side effects. But although it's terrible, and I never want to see that, it's like, how else do you know? And how do we advance ourselves without finding that out? Because unfortunately, sometimes time may not be our best enemy or our best friend, but it's going to tell us what this drug actually does. So I get kind of annoyed when I see those commercials. Oh, did you have this? Did you have that? And I'm like, or did your family die of this? Call us so you could get your settlement. And I'm like, okay, let's say that I lost somebody due to this disease. Oh, $100 million is going to make me feel better that my aunt passed away or my mother passed away from this drug. To me, I can't justify suing somebody over something. To me, it's just money hungry. That's how I see it. My brain doesn't comprehend, well, money isn't going to bring my aunt back or whoever. uh, and that's what has to, and that's another reason that that's another reason why drug prices go up, and we've talked about that in the previous episode. But yeah.
No, so obviously, I know we're talking about Sue Happy, and we definitely discussed that in the last episode. But to kind of reel back to the conversation with drugs out there that's on the market, right? There has been a bigger, heavier push to kind of get away from these drugs with a lot of side effects, these drugs that are made in these labs with all these chemicals that, yes, it may cure with that, may fix you with this, and they hit you with all these strong drugs. And then there's a push on the other side of things, right, where maybe going more natural, more healthier, maybe it won't be the best cure in the world, but you can find these other drugs. And I think it all also not only leads to putting bad things into your body, but a lot of these things we put into our body become addictive, right? And then they become part of your we try to help this guy, now he has an addiction to this drug and he needs it now. What's kind of your thought process regarding the stuff that is on the market?
So there's definitely a difference between addiction and dependence. There are some medications that the body can become dependent on after a certain period of time, meaning if you were to stop the medication, you're going to withdraw from it or that sort of thing. Addiction is a different thing altogether, where that starts to be, it's usually still also a dependence is involved, but that also then involves bad behaviors such as medication seeking, ruining of life, caring less about other things, and that's definitely two separate ideologies, because there are some medications that you need it, it's there, you are going to become dependent on it because you are on it for a period of time, but that doesn't mean you're addicted to it.
So my question, and TJ, if you want to if you have another question on addiction or whatnot, but I know we're getting close to the hour marker of our show. So I just want to, I have one other question that I didn't get to ask to Tara yet that I want to make sure that we get in.
Can I just say one more thing?
Sure,
on the
go ahead. Go ahead. Please, go ahead.
I actually have
go ahead.
family members on this. So this was actually one of the big things I definitely wanted to communicate and talk on, which is obviously pain relievers, right? I don't know if you call that a dependency or an addiction, but I literally had family members, lose it all, lose their job, lose their homes, lose their family because of pain medication you get from your doctors that are supposed to help you, that are now literally, you stop the pain or whatever, has now destroyed your life. And a lot of people have a big claim that herbal medication are so much better because it doesn't have those side effects. So I just want to, talking about addiction on that aspect, I want to get your point of view on stuff like Oxycontin, I think, right? Is that one of the big pain medication ones that people get addicted to? What do you have to say on that?
So obviously, if they're on a medication like Oxycontin, which is an extended release opioid medication, their pain levels are high. I think it's safe to say. So when you're on a pain medication, say like an opioid-based medication, which is most of the control pain medications out there, you will become dependent on it in about 2 weeks if you are taking it on a regular basis. And so that's just to say that you would go through withdrawals if you were to stop that medication cold turkey. Okay. Now, addiction can a lot of times follow that. And some of that is some people are kind of, it seems, pre-programmed for addictive type behaviors, whether it's to medication, gambling, alcohol, whatever. Some people just naturally have more of an addictive type personality. The issue with pain is that people are trying to chase this idea of being pain-free. And that is not necessarily what the goal is when taking pain medication. It's actually to improve to a point where you can kind of resume a normal, productive life. So you're still not expected to be pain-free when you're managing pain on these medications. and then it's definitely something that it needs to be controlled and regulated to look for those types of behaviors of addiction, where they're abusing the medication or seeking it in a not appropriate manner. And that's part of the struggle with pain medication specifically.
So on that a little bit, doctors are prescribing this stuff out there when there seems to be studies on herbal, like marijuana, like CBD, that seem to have better results without these negative side effects. Why don't we see a bigger push for these other so-called medicine? And this goes back to, again, my feeling on lobbyists, my feeling on control, insurance, people forcing you to take certain medication because it makes money, it's on the market. Why don't we see, when there are studies to show that, not better, it's like what you say, maybe if you're in so much pain, you need to have Oxycontin. That's just the proven thing that is better. But there are other pain medications that are out there that obviously marijuana, CBD seem to be helping out with a lot better. Why aren't we pushing that to the people?
So it goes back a long way, I think, to when the U.S. essentially deemed it to not have a medical purpose. Currently, marijuana is a Schedule I medication, which indicates that it has no medical purpose. So right off the bat, it's not got a lot of studies and a lot of
well, who deemed
clinicals.
that? Like, why was it deemed that way? I'm sorry.
Yeah, so it's been a while since I looked into that, and I think it was one of those, depending on what you see. I don't want to say because I don't know.
Okay,
for sure.
No. Not putting the mic on you, but thank you for talking a little bit on it. Again, I'm a little interested, and actually, on the top of the hour, we're going to be breaking into our guests who maybe can fill in a little bit more on this subject. But before we touch on that, Mikey, you said you wanted to throw one last question, and then you can take on to our next guest.
Yeah, I mean, you pretty much ran with that. You kind of pretty much asked it, and it seems like that she does, understandably so, maybe doesn't have really that much of a perspective on it. But I was going to essentially ask, what if you see benefits to herbal medication over some prescriptions, if you've ever seen that in your field, or maybe it's just something you've never been exposed to, or
great question.
Maybe, so like I have a cousin who had seizures, and I understood that they were rubbing, I don't remember if there was something else. There was something that happened, and those CBD oils were essentially supposed to help her. So they say that it helped, and she didn't have to get onto pain medications and whatnot. So from your perspective, what have you seen? Have you seen examples of herbal medicines like CBD, medical marijuana, actually helping people to where maybe Oxycontin maybe wasn't the best solution?
So that's an interesting question. So because marijuana and whatnot are still classified as a class 1 medication, technically pharmacists can't have pretty much anything to do with it. Also gotcha. Being said, I think along with most people out there, they've seen stories and heard stories about it helping people and people finding relief from CBD oil, sometimes actual tinctures of marijuana itself. There is a medication that is actually essentially a reduction of marijuana that is available in pill form, that is available in the pharmacy if that's what you need as well. But I think seizure is one of the things that they have the most evidence currently for, as far as usefulness of CBD and whatnot. And I think I've seen a lot of people, helps with their arthritis. Also, the other thing we've seen is, especially like AIDS patients or cancer patients, after they've lost their appetite stimulation, with it is one of those ones that we've seen a lot of studies and proof for. What I would love to see is having more studies done with it. And I think that's kind of where we're getting to as a society, as more people are finding that it's an acceptable everyday option.
So on that conversation, we're going to pass around the blunts and we're going to get this party started as we break up to our next guest. But no, so Mikey, I let you end this episode and get ready for part 2. Take it away.
All right, guys. I thank you so much, Tara. Thank you so much for joining us. Your information is awesome, and I can't wait to start the second part with you here. But we're gonna have our next guest, Lucas, join in. He's from the natural medication side of things, so we're gonna ask some of the same questions, get his perspective on things and how he feels. I'm actually probably asking the same questions to him because I'm curious on both sides on how it gets answered and whatnot. But I'm really excited. Stay tuned. Wherever you're watching, this is in the middle. I bid you adieu.
Okay, drink time.